Ladies and gentlemen, I will try to keep this video as concise as possible. I would like to share with you a dataset from Czech Republic that got public thanks to Angelika Bazalova and Petr Šourek, who requested this from one of the health insurance companies in the Czech Republic. And you can see that we have very basic information actually. Week of birth, gender, week of the first vaccination, type of the vaccine according to the distribution, like the vendor and the distributor, second vaccine and the vendor and the distributor, third vaccine and the vendor and the distributor, fourth vaccine and the vendor and the distributor, and there is also a column of the fifth vaccine, but that's actually the same as the fourth vaccine. They didn't share that with us. And if the person has passed away, there's also a week of his or her death. So that's the data set, and it has about 1.5 million people, so that's already something. And if you are interested in the codes of the vendors and distributors, it's here. Yeah, so you can see that 99930 is Pfizer, 99931 is Moderna, 99932 is AstraZeneca, 99933 is Johnson & Johnson. CureVac, there is actually no CureVac in the dataset. Novavax, very few people who actually waited for Novavax. 99336, once more Pfizer-BioNTech, but with another distribution. 37 Moderna, another distributor. 38 AstraZeneca, another distributor. 39 once more Johnson & Johnson, another distributor. And 40 is actually distributor for children 5 to 11 years old. So that is the dataset. And it has been told to me that there are actually no real harms, but let's start with very basic things, like there is of course healthy vaccine effect. So you can see that for those born in 1922, actually the healthy vaccine effect is very strong. They have 6 times better chance of survival if vaccinated. And that's of course not something that could be explained by the magic powers of the vaccine. So there is very clear healthy vaccine effect that diminishes with for younger people, somewhere around those born in 1970. The effect actually becomes negligible, and here for the youngest people the effect becomes somehow strange. You can see that for those youngest cohorts, actually we have here something very strange. Those who are not vaccinated are somehow better off. Those born in 2002 or born in 2005 or born in 2009. It could be that actually the people who are somehow sick did receive the vaccine and then died. So that would be actually some unhealthy vaccine effect. But it's also possible that we are seeing here some real harms of the vaccines. Actually, it has been told to me from people who know math much better than I, that there are no real harms visible in the dataset, but I don't think so. I think that we can actually spot there things that show some real harm, and it's really vendor dependent or distribution dependent. So here are the not vaccinated in blue, their chances of survival. Then here are those vaccinated with one dose of AstraZeneca. And those in blue, in yellow, you have here those vaccinated 2 times with AstraZeneca. And you can see that there's something very strange happening, that those vaccinated with one dose of AstraZeneca are actually worse off than those that are not vaccinated at all. But those who receive 2 doses of AstraZeneca are actually somehow better off. So in overall, so that is really strange, and like how to explain that. We can see what is happening with those who received only 1 dose of AstraZeneca. So this is these are 2 doses of AstraZeneca. This is 1 dose of AstraZeneca for the people born in 1957 and younger. And you can see that actually the graph is very uneven. There is this time of 38 weeks at the beginning when people are dying in a higher pace for actually 37 or 38 weeks. Then there is a gap more than 20 weeks when nobody died from those who received only 1 dose. And then there are 5 more deaths in the next like more than 40 weeks. And that's really strange. Like you can see the deaths are not really evenly distributed in the time. That's something that good vaccinologist doesn't want to see. And here's the second dose, those who received exactly 2 doses of AstraZeneca and no dose further. And you can see that actually also here the deaths are distributed in an uneven way. The linear distribution is actually plotted here only to show how uneven the deaths were distributed. This is overall death count in time based on the time from the last vaccination, and you can see that the distribution is not even, and we would like to see it even. This really shows that something is happening in the dataset. So here we looked at all the deaths after the first dose in turquoise and after the second dose in red, and you can see that here are the absolute maximums. They're absolute maxima, and that's something you wouldn't like to see after medical intervention on a relatively healthy people. Like you don't want to see the deaths following the intervention. That's something that shouldn't happen. Okay, this is Johnson & Johnson. And you can see here that actually for those born in 1957 and younger, the distribution of deaths after Johnson & Johnson is almost entirely even, and the death count is linear, and that's what we would expect. So, and this is actually something that looks almost perfect. But when we looked at overall deaths, like including the oldest populations, you can see once again that there is this absolute maximum, like 21 deaths in 1 week. And that's once more something if it was a study, like on some people, like this is something like 11,000 people. Yeah, 11,000 people are those 1957 and younger. So this is something you don't want to see in the data set. Like there is some week that has immense amount of deaths. This is something fishy. So there was a reason why this vaccine is actually revoked in the US. But all the other should have been revoked before this one. Yeah, all the other genetic vaccines. Because as you can see here, for younger population, the signal about harm disappears. But for older population, there is this peak, this ugly peak. Yeah, so here we have the first dose of Moderna, and you can see once more 20 weeks after the first dose, people are dying in higher pace. These are once more young people, like born 1957 and younger. And there is this spike in deaths, then the gap, and then like something like background deaths are following. So this is something also good vaccinologist doesn't want to see. This is the same plot, only plotted in a different way. Yeah, the line here is just to show how uneven the distribution of deaths has become. This is the second dose, and you can see that still it's really quite uneven, the distribution of deaths. This is the second dose, just plotted in a different way. Second dose, just plotted in a different way. And this is the third dose, and you can see that the distribution still is very strange. And this is the same graph, just plotted in another way. And these are 4 doses in absolute weeks, like the 0 is actually beginning of 2020. So you can see that here is after the second dose especially, there is this absolute peak that coincides with actual rollout of the booster. Yeah, these are people who stayed with Moderna. These are that took only 2 doses. These are those who took only 1 dose. And good vaccinologist doesn't want to see these absolute peaks. That's something that you don't want to see after medical intervention. It shows that there is some real harm. Yeah, so here we have the same plot for Pfizer but with different scales. So there is absolute peak after 4 weeks in the first dose. There is absolute peak for the second dose. There is this rollout coinciding with the absolute peak of the second dose. And there is this third dose that actually stays somehow linear but quite high. And the fourth dose. The third and fourth dose are actually developing events. Yeah, and here we have the first dose of Pfizer, and you can see the distribution of deaths is really quite uneven still. You can see that we have a lot of deaths in the first 20 weeks. And if we look at the deaths after, this is just the same graph, just plotted in a different way. Here you can see also uneven distribution for the second dose. The same graph in a different way. And here you can see the third dose developing even, and it's much more linear because the vulnerable populations didn't continue mostly with the third dose. I think this is actually already Darwinian selection in the working. The same graph, just differently plotted. And this is already the fourth dose. Very few people attended the fourth dose. Yeah, and here is the same graph, just plotted in a different way. Yeah, these are the most toxic quotes, lots used in the Czech Republic. According to the official data, it could be that they are not toxic, just they received adverse event reports. These are the lots. Here is the distribution of the lots according to the reports. The blue ones are actually how many vials were distributed, but we don't know whether they were used. The red are actually the reports about some events, adverse events. The orange are the reports about serious adverse events, and the green are actually the deaths. Yeah. Of course, the vials are like 1 to 400, to fit them into the graph. I actually made those 400 times smaller. Okay, and the deaths are 1 to 4, like the most deaths for one lot were 4 deaths reported in the Czech Republic. People don't report too much in the Czech Republic. Yeah, here is the same for the vials of Pfizer in the Czech Republic. So, I hope that this is helpful. I thank very much to Tomáš First, who helped me with some critique of this report. He doesn't share my views, but he actually helped me with some critique of the plots. And thank to Angelika Bazalova and Petr Šourek who got the data. Have a nice evening. Hope that next time I will have something better to share with you.